Welcome, and thanks for taking a few minutes to check out this quick overview of the VMSG Dashboard Public Health Performance Management System. The VMSG Dashboard truly is a public health performance management system. It's been developed and updated with feedback from public health departments like yours all across the nation, specifically for the needs of public health. At the core, the VMSG Dashboard is a comprehensive operational planning and execution system. Operational plans, by definition, take the plan all the way down to a specific set of activities to be accomplished by a specific team of people in a specific time frame and measured in a specific way. The Deming or PDCA cycle, plan, do, check, and adjust, keeps plans alive and constantly moving forward. The dashboard is in use by hundreds of health departments across the USA who are pursuing FAB accreditation or reaccreditation. In every case, the dashboard has been designated by FAB as fully demonstrated, their highest level of compliance for the implementation of Accreditation Standard 9.1 and the related measures. Measure 9.1.1 talks specifically about engaging staff at all levels in your department with performance management. The dashboard is a full multi-user system, giving everyone their own unique username and password. This allows you to easily engage your entire staff, including selected external partners, to distribute the opportunity to keep the plans and information up to date. So, what is performance management? Well, there are a bunch of definitions, so I'll just give you ours. We believe that over the years, we've narrowed it down to three key elements. First, creating good, solid operational plans for almost everything you do in the department using this public health standard hierarchical planning model. Some departments like to start with what FAB calls their six-pack of plans shown here. Once these are up and running, you may want to create additional operational plans for each division, office, and program in your department. Next, put the plans into motion and monitor their performance in real time. There are a bunch of performance monitoring tools in the dashboard. During the execution of the plans, you'll be looking for anomalies, something to start heading south, or not meeting expectations. Once you see that, this is where the PDCA cycle comes in. Each plan is constantly moving through this cycle of planning, execution, monitoring, and making adjustments or corrections to the plans and/or resources, again, in real time. Now, let's switch gears a bit and look at some of the performance monitoring tools. The dashboard screen itself is one of those performance monitoring tools. We call this performance monitoring at the macro level. On the dashboard, you can see the actual performance of the entire department or of any division, office, or program within the department. If I'm the health director or senior staff, this box will show me the department level, and I'll see a snapshot of every plan in the entire department. If I were the WIC director logging in, this box would show WIC, and I'd only see the status of WIC plans and people or my area of responsibility. Here you can see the big picture. The status of all the goals, objectives, or activities, and how you're performing against the assigned timelines. Everything here is clickable, so you can drill down to the underlying data without having to search around for it. At the bottom here, you can also see a snapshot of the performance of each of your staff, programs, or your strategic priorities from your strategic plan. Up here in the top right, you can see the specific objectives you'd like to keep your eye on. These are typically things in red or yellow status and things that you're working on personally or your team is working on. A complete document management system was added to the dashboard, initially to assist departments seeking state or national accreditation. Collecting, organizing, and managing hundreds of documents before they get submitted to EFAB or the state accrediting body can be a daunting task. The document management system allows you to attach documents to any part of any plan so you always know exactly what and where they are. The document management system is also great for things like policy management and grant management, where you need immediate access to the related documents. 3D planning is basically a big overlay of all of the plans. It allows you to look for commonalities across all the plans and documents. For example, which pieces of which plans support each of the 12 essentials of public health and accreditation? Which plan elements are related to FAB Standard 6.1? Which pieces of the plans support your strategic priority of partnering from your strategic plan? And which documents will you submit for each FAB standard and measure? 3D planning is a great way to identify commonalities, gaps, and overlaps across all the different plans and documents in the department. Intelligent, real-time planning is a streamlined way to keep the plan information up to date. It's a combination of an automated email notification system and the quick update tools. Here's how it works. First, you set up a schedule for the real-time planning notifications. These can be set anywhere from daily to once a month or anywhere in between. Let's assume the notifications go out on the first Wednesday of each month. Here's what happens. At 2 a.m. on a scheduled day or days, the system looks at each of your users who've been assigned as team leads and asks 3 questions. Have you been in the system in the last 30 days and updated your stuff? Do you have any activities behind schedule? Do you have anything overdue? If selected, any of these 3 will trigger an email to be sent. The emails will go out to internal as well as selected external folks. In the email will be a link which will take you right to the quick update screens. Quick update is an extremely simple way to enter data values, set the status traffic light, and add a note. The user will cycle through their assigned activities and objectives and be done. The entire process usually takes only about 3 to 5 minutes per person per month. Without this system, the ability to collect updates from everyone goes way down. Public health people just don't have the time to spend hours updating plans. The VMSG dashboard has reports to cover everything in the system. The reports are all flexible for dates and detail levels. VMSG Public allows you to interactively create public web pages to share with your constituents and community. You can highlight any or all of your performance indicators at any plan level. As you can see, each graph has mouse overs to show you the detailed data behind the chart. Performance indicator web pages can be created literally in just a few minutes. You can create as many indicators on a page and as many pages as you want. The web page links can be shared by email, on your public web page, or on social media. The Accreditation Reaccreditation Project Plan was developed by condensing all of the documents created by FAB for the accreditation and reaccreditation process into an automated operational plan. Here you can see the 12 domains. For each of the domains, you can see the standards as well as the reaccreditation measures. For each of the standards, you can see the measures. And then the best part, for each of these measures is a specific set of activities. If you complete these activities, you will have completed the measure. Now, most of these activities require a narrative or a document of some sort. As an example, the health department must document that the process for development of a community health assessment includes participation of partners outside the health department. Now we can go over to the document management button here, click on that, and you can see that we've attached specific documents related to external partners with the CHA. In this plan, you can assign domain leads and target dates for all of the related activities. This plan then becomes part of the real-time planning process, and each lead will get an automated email notification to drive the process and keep the information and documents updated. The Accreditation and Reaccreditation Plan is a great way to drive, track, and manage the entire process from start to finish. Using the accreditation plan gives you the ability to do a virtual mock site visit. Instead of the expense of flying someone in, paying for hotel, meals, and their daily rates, we can allow your designated mock site visitor to review all of your plans and documents remotely. The mock site visitor can review each activity and grade the department's responses and documents. Once the site visitor has completed the review, you'll have access to a report showing the complete results of the review and the specific areas requiring attention before the FAB site visit. The dashboard's context-sensitive help and information is available from any screen at any time. When you click on this help icon at the top right of the screen, you'll be directed to the proper help topic based on your current function. Here, you have a bulleted list of everything you can do on the screen, as well as access to a complete user guide and a 3 to 4 minute training video about the specific function. All of the individual training modules are rolled up into 4 training curriculums based on the user type. These training curriculums range from 20 minutes for occasional users to about 2 hours and 40 minutes for system administrators. Training and help are available 24/7. To summarize, here are some of the primary benefits of the VMSG dashboard. Our sliding scale annual license cost model makes the VMSG dashboard affordable for departments with only a few users or departments with hundreds of users. No startup costs, no training costs, no support costs. With individual operational plans for each division, office, and program, you can manage each part of the health department in real time. Three-dimensional planning allows you to identify gaps, overlaps, and commonalities across all of your plans and programs. Many of the dashboard features were designed to help departments navigate the FAB and state accreditation and reaccreditation processes. The dashboard has built in a complete FAB accreditation project plan. From an IT perspective, the entire system is cloud-based. No installation is required. You just need a web browser on your end. We do all the backup, support, and training on our end. Thanks for taking time to review the VMSG Dashboard Public Health Performance Management System. If you have any questions, would like more information, or would like to see a live demonstration of the VMSG Dashboard, please contact us using the contact information here.